Hi everybody, welcome to Solutions. Today we're going to be talking about reaching out into the community. And we have some great people here for us today. First of all, I want you guys to give a big hand to my DJ, Jason. Let's give it up to Jason, y'all. We have a special show for you. Today we have some medical students from USC, UCLA, and all over the Southern California that have come into the community. We want to talk with them. We have LA Care here, and we also have a little special thing from Christopher Nance, Channel 4 News. So let's get into our show, and I want you to introduce yourself.
I'm Dr. Gilberto Granados. I'm from the Department of Family Medicine at Harbor UCLA.
Okay. From Harbor UCLA?
Harbor UCLA.
And can you tell me about the program that you guys are doing over there?
Well, we have this program. We've had it for about 9 years now, and it's an evolving program. And so now we have 12 medical students. We have 11 undergraduate students who are trying to get into medical school. We also have a group of high school students from Banning High School. And we're basically linking all of those students, taking them into the community, showing them how to work in the community. At the same time, they help themselves get into higher levels of education.
That is great. And what is the name of this program that you guys have going?
It's the Department of Family Medicine's Community Health Fellowship.
Community Health Fellowship.
Right.
That is great. And we also have some of the students that are here in the studio audience and the audience here that are in your program, right? And we're going to get a chance to talk with them. And we're going to start over here with Jose. Jose, can you tell me how has this program affected you?
Well, as a medical student at UCLA, we spend much of our time in the classroom. And initially, when we go into medical school, we want to help people, but we're stuck in lecture like so much that it's nice to go out in the community and help people, especially those people who really need services.
Right.
And it's just a great feeling to work with people and get to know people and help others.
That's great. Yeah, that's great. Would you tell me something about, too, how this program has affected you? And what do you like about this program?
Oh, right. It's for the same reasons why I applied to the program, was because throughout high school I was always into doing community service, and once I got into medical school I was disappointed that I didn't have time to do the things that I enjoyed. Like I used to mentor and I used to do community service. So it was really, it was more of kind of an escape, but also more of like a path to do something else that I enjoyed but didn't have the time to. And it has affected me in the sense that it's also motivated me to continue continuing with my education, because also going through medical school,
it's hard sometimes.
Right,
yeah.
it's very hard. It's very hard, and in my family it was hard to get that support system. So it was getting that hands-on experience and knowing that you're benefiting the people and the people showing gratitude, and it's just really rewarding, and it's more of a driving force to continue with my education.
Great, great, thank you. And we have some people on this side too. Can you tell me a little bit about the program too?
Sure. This program has been really, really great. You know, just for me, not only are we able to mentor high school students, but we're also able to follow doctors around to see, you know, what they do on a daily basis, how their schedules run, and how, you know, that's what we're going to do. So we should be able to, you know what they're all about. All about. And it was great. We were able to just reach the community. We did 2 health fairs for the city of Wilmington, and it was incredible. We had a lot of people that came out that were able to get services that, you know, were for free, you know, that they normally may not get. So it was really an incredible experience for me, and I also liked just being able to work with, you know, Dr. Granados and Dr. Pavula, and they were able to just you know, mentor us through all the process of getting into medical school and things like that. So it's a lot of work, you know, but it just seems like it's doable now that, you know, I've been through this program and been able to do that.
That is great. That's great. You guys are doing a great job there. We also want to hear from you, so can you tell me something about the program and how it's working?
It's been an excellent opportunity to get involved in the community and to see what the needs of the community are. Dr. Granados, he's taught us a lot about why people aren't able to access health care, the underserved community, and he also indicated to us that one of the main indicators why people don't access health care is because they don't have insurance. And in the community that we worked in, Wilmington, there's a lot of people that are uninsured. So there's something needs to be done about that.
That's very true. I want to talk about that too. What did you guys find out in Wilmington with the health fairs and stuff? You guys compiled a lot of data and everything. So can you tell me a little bit about what you guys found out there?
Well, what the students did is that they developed a measuring tool where they figured which people who came to the health fair had health insurance and which ones didn't. And then we looked at the rates of anemia, dental referral, multiple measurements of health or indicators of health. And what a lot of these students found out was that in almost any indicator of health, the people without health insurance had the worst health indicators.
Right.
So they learned a lot from it, but we also learned a lot from that data as well, because now we know that we need to target certain populations that are hard to reach. So.
Right.
The rates of anemia were much higher, rates of having cavities, rates of having uncontrolled hypertension, rates of having weight problems like obesity. They're all much worse in the population that didn't have health insurance. So.
Right. What are some of the things that you think that we can do to get health insurance to these people?
Well, there are a lot of barriers right now.
Right.
There's a lot of eligibility barriers and there's non-eligibility barriers. And some of the things that we can do is we can target populations that are traditionally not enrolled, like provide more Spanish or other languages.
So the language is one of the barriers. Let me back up a little bit. Let me talk about what are some of the barriers and what are some of the barriers that you guys saw while you're out there servicing the community. Can you guys tell me?
Well, one of the main barriers was immigration status.
Okay.
A lot of non-immigrants who live in Wilmington, either for fear of being labeled as a public charge or for fear that it's going to affect their status, they don't access these services.
Okay.
Well, one other thing was a fear of having to repay the government for the services that are accessed. So that was another one.
That's great. So what are some of the other barriers that you guys found? I know that the language, and like you said, about the being deported and stuff like that. What are some of the other things that you guys found?
Well, the application process is very cumbersome. It's continuously changing. So with the age of the child, the eligibility changes. So if a kid is 1 year old, there's different criteria. Once a kid becomes 5 years old, another criteria. They have to reapply continuously. So parents get discouraged. And it's very hard to keep up. It's hard for us to understand what those eligibility criteria are.
Right.
I can only imagine what it is for a single mom with,
or a single dad.
Or a single dad.
All right, don't forget about single dads. We're out there.
That's right. But it's very, very difficult to just maneuver and navigate the system, and we need a more user-friendly system, and I think that would definitely help.
That's great. Also, you guys' program dealt with the high school students the high school students from Banning, and I would like to talk with you guys. How do you guys feel about this program?
It's taught us a lot about working together, especially with college students, and how it's going to be for us, everything that there is for tests, and just working around with them were great. It was really a good experience.
Yeah, that's good. We have
we did a lot of shadowing with the doctors, with the undergraduates and medical students, so we didn't feel left out. Even though we're like high school students, we went to their lectures. Some of them were like, "Oh my God, what is he talking about?" Yeah. But there were some of the doctors that were like, "Oh my God, no, I understand what he's saying." Right. But they did a lot of SAT preparations, and that was great. Like last year I took them and they were like really hard, but this year, with the help of Dr. Granados and the whole program, it was great. The questions were much easier, and it's a great program.
We understood most of the words.
Yeah, definitely, especially being around doctors. You guys good.
Vocabulary, the math, it's there. Oh my God.
That's great. Also, we want to get a chance to talk about what took place at Dana Strand. And can you guys tell me a little something about Dana Strand and what took place there?
We were at Dana Strand. That was our first health fair that we were at, and we were able to provide a lot of services for the people that came out to that community. We had approximately, I believe it was 276 people come out, and it was mostly women that came. We were able to provide them mammograms and immunization for the children. They were able to get vision care, and also we were able to take their blood pressure and height and weight and diabetes, and even the UCLA dentist school sent out their students to help the people there, and they were able to give them sealants and be able to give them checkups, and also teeth care, be able to give children like how to brush their teeth and such. So it was great.
That is great. Felipe, we were over there at Dana Strands. Can you tell me a little about something what we were doing over there and what you saw over there?
Well, I thought it was excellent, actually. I mean, I had a lot of fun interviewing people. I had a lot of fun with the dentist, though. I mean, I thought it was great. Yeah. That was really cool. And they were actually filling in cavities and all that, and actually just doing work, like 3 people on 1 child, and they had 2 stands. So it was really cool. Yeah. I mean, a lot of the people there, man, they all have a very big heart, man. And there's a lot of love around there for those people. Because, I mean, it was a lot of fun. I had a blast over there.
Great. Now, listen, we're going to we're going to show you some footage for what took place over there at Dana Strands, and then after that we're going to go to a little break, so you guys will be right back and enjoy the footage. Thank you. Thank you. Hey everybody, this is Mel Isaiah Carter with Solutions. We're here in Wilmington at Dana Strands at a health fair, man. You guys, we're gonna have fun today. Check all this stuff out. All right, peace. Explain what Dana Strands is for people who don't understand what Dana Strands is.
Sure. Housing authorities has different developments in different locations, and they're basically housing projects. These housing projects are pretty old because a lot of them were built for the wartime.
Right.
Now they're where low-income residents live in the community, and housing authority is basically the agency that provides services, keeps the buildings up and things like that.
I see. Well, and how do you feel about what's taking place here today?
I'm very happy. This is the best event we've had because we've had, I would say, about 80% participation from volunteers, basically resident volunteers.
Hi, I'm Rod Morales, back with Solutions. We're here with
Alina Bueno.
Yeah, and so Alina, what's your purpose in here? What are you doing here?
Well, I'm a health educator. I work at the Childhood Injury Prevention Center at Harvard-UCLA Research and Education Institute, and we and the Child Life program at Harvard-UCLA receive funding from a federal program called Reading is Fundamental. It's the nation's largest literacy organization, and they allow us at this community center in Dana Strand to purchase books for the children living here and to provide 3 free book distributions per year, where each child receives 1 free book.
And we want to know, Heather, what's your purpose here?
Okay, so basically to provide healthcare to people who may not have access to healthcare, and it's just a good thing to come to the community and have people be able to come and get free services.
When did you decide that you wanted to do this?
A long time ago, I'd say in high school, basically. But I think in college, I definitely realized that there was a need for minorities to be in medicine, like you said, to be role models, and also to fulfill the need of just good health care in our communities. So in college, I definitely decided this is what I wanted to do.
Right on. What do you think about LA Care? What's the purpose here in the community?
Well, our purpose here in the community is we have committees that meet. we have committees that meet, 11 committees that meet once a month throughout Los Angeles County, and the purpose of these committees are for the members of the actual health plan to come to voice any concerns that they may have with the health plan. It's their way of an advisory committee to the Board of Governors, the people who run LA Care. So it's their way of the members to come and have some input in the health plan, what's going on.
How's it going? My name's Felipe, and we're back with Solutions. We're here with a friend of ours named Jose, and we would like to ask him a few questions. Jose, how long have you been with the program?
I just started this summer, so this is, I would say, my first year, but I hope to continue maybe next year too, if they would let me come back.
What brought you to do this?
What brought me to do this is the many components of the program, but The one most important component I think was something like this for me, to come out of the community and really help the people who really need healthcare services, mainly the underserved, the Hispanic population of here at Wilmington.
That's really cool, dude. That's really cool.
What's the name of your guys' organization?
Dana Strand Bike Club.
What is it for? What do you guys do?
Safety.
For safety?
Yeah.
Biking? What else? What do you guys do?
Teach us how to bike. Teach us how to move. Yeah. It shows hand signals, like when we're gonna turn on the street and we go with a group to ramps and stuff. And we gotta be here every Friday and stuff. And then we gotta wear helmets and everything. And we gotta stay in a group.
Does it also help you guys stay off the streets and out of trouble and stuff?
It helps us stay off drugs, gangs, and that's all.
And off the streets.
Yeah.
You guys like your program?
Yeah.
And do you guys want more people to get in your program? What would you say to someone out there? If you want to tell them to get into the program, what would you tell them?
To come and join. Even adults could come and help supervise us and stuff.
What?
Even adults could come and help us supervise and stuff.
All right, great. Huh?
They could ride with us, they could go to field trip with us.
Ever wonder how football players prepare for the big game? They start with a game day meal that's more than you and I could imagine eating for breakfast, lunch, and dinner. There are no game day meals for the 1 in 5 children in America who are at risk of going hungry every night. You can help them get the nutrition that so many of us take for granted. Share our strength. Call or log on now to find out how. Please share your strength. It's their future.
Hi everybody, this is Mel Isaiah Carter with Solutions. I'm here with Christopher Nance with Channel 4 NBC News. How are you doing, Christopher Nance?
Well, it was a pleasure having you here. Thanks for coming to the office.
Thank you. Well, it's great being here. Well, I wanted to come over here and talk with you about your program that you're doing, Reading for Life.
Okay.
And can you tell us a little bit about how it started? And well, let's start with how it started.
All right. The program's called Let's Read for Life, and we started this program because we noticed that there was a deficiency in a lot of the schools that I would visit, where some of the science programs and the science routines that I was doing, they couldn't understand or comprehend because their reading skills were a little weak. So we came up with a reading program, a 6-week reading program called Let's Read for Life. And in that, I go out to the schools twice. Once to challenge them to read. And for example, I expect each student to be able to read in elementary school at least 10 books in the 6-week period of this program. So if there's 1,000 kids at a school, I want 10,000 books when I come back.
Right.
And we bribe them. You know, I got Disneyland as a sponsor, Universal Studios, Magic Mountain. We got Nestle. We got, I left out a theme park. Universal, Disneyland, Magic Mountain, Knott's Berry Farm. And they give out tickets. And they give me these tickets, and if they're a top reader in the whole school, I'll let them choose which theme park they want to go to.
I want to get in the program.
Well, I know, I do too. And I challenge them, and I tell them what their goal is on the first visit. I say, if you meet that goal, you get to be on the same network that the world champion Los Angeles Lakers were on.
Hey,
now, can you do it? And they, yeah, we can do it. And they start reading right away.
Right. Do you find that you get a good response from the parents? Are the parents getting involved in this program too?
I get great letters from parents that will tell me, my son never liked reading before and lived in front of the TV set, and now that he's been on TV and has seen himself, and his friends and his cousins and everybody have seen himself, he wears sunshades, and he walks around carrying a book under his arm.
That's
and I'm like, well, that's cool.
That is
cool.
That's cool.
Yeah, you've got to help out wherever you can.
That's true.
You know, some people could just go to their nearby school and read a book 30 minutes every week, and that would change a child's life forever.
That's true.
You know, it doesn't take money. It doesn't take a lot of time. It just takes the desire to improve the environment, and that's my goal. I want to leave this place a little better than I found it.
That's right.
Yeah.
I'm trying to do the same thing. Well, Christopher, it's great talking with you.
Thank you, man.
Great talking with you.
Pleasure's mine.
And everyone out there, please look for Solutions. Look for Christopher Nance on our show. And remember, like you said, if you can't take any time to spend with young people to go read at a school or anything, that would be great. And we look forward to seeing you more. Bye.
What is it?
Everybody, how you doing? Welcome back to Solutions again, and we have some great guests for us. We talked a little bit about what's going on with Dana Strands and the medical students and the high school students, and now we want to talk about some of the solutions, some of the things that we're trying to get done to help the situation in Wilmington and all over in different areas. And one of the solutions is you guys right over here. And can I have you introduce yourself?
Well, I'm Diane Picari. I'm the Director of Community Outreach and Education at LA Care Health Plan.
All right.
And I'm Keith Malone. I'm Director of Public Relations for LA Care Health Plan.
Okay, what exactly is LA Care? What is LA Care?
We like to describe ourselves as a community accountable health plan, and what that means is literally we're accountable to the communities that we serve. About 7 years ago, people from all over Los Angeles County, and that included consumers, consumer advocates, physicians, pharmacists, people from hospitals and community clinics, they all came together and they laid the groundwork for a very special health plan. I mean, that's why Diane and I are both working there.
Right.
And what that means is really that we have a health plan that has a very strong relationship to the communities that we serve. We only serve the cities and communities of LA County. That means every person in this room lives in one of the communities that we serve.
Right.
So we have over 500,000 members just here in LA County who receive coverage through Medi-Cal or Healthy Families.
Okay.
And most of our employees, probably about 90% or more, live in this county as well. So we have a real strong connection here.
That's great.
And so that's one of the ways we really describe ourselves. What's also unique about us and really makes us a community accountable health plan is that we have a strong consumer focus.
Mm-hmm.
For example, our Board of Governors is composed of a variety of people, including representatives of hospitals, physicians, community clinics. But more importantly, we have two positions that are very consumer focused. We have two consumer representatives,
right.
And they are elected by our own health plan members. And so those two individuals represent over 500,000 people in this county.
That is great.
So that's one way that we're really accountable. We also have, and Diane's going to tell you a little bit more about this, when those community people created us, they created a network of community advisory committees. We have 11 of them throughout this county. And so that's another way that we really remain focused on our communities and as well as our consumers.
Okay. Diane, he was saying that you're going to tell us a little bit about that. How are you guys reaching out to the community? What exactly are you doing with the community as far as their participation and everything?
Okay. Well, we have 11 regional community advisory committees that represent all the unique, distinct parts of LA County.
Mm-hmm.
We have one that meets and represents the South Bay. We have another one that represents Long Beach. Still another one representing South Los Angeles. And the purpose of creating these committees was so that our members, the providers that serve our members, and community advocates would have an opportunity to tell us how we're doing, but also to respond to community issues. And so these meetings that happen monthly are places where people can talk about what's going on. And they take these issues and will either make policy recommendations to LA Care on how we can do better, but secondly, they also can do projects to help to respond to community issues.
Right. That sounds good. And go ahead, what were you going to say?
Well, for example, the one that we have in the South Bay actually helped and participated in the health fairs that were mentioned earlier at Dana Strand. And so we're really looking forward to hearing more about what the Community Health Fellowship has done, and hopefully our Regional Community Advisory Committee can do something about it in the form of a project or something.
That's great. So you guys are also, what are the goals or some of the things that you would like to see LA Care do? What are the goals for LA Care? Can you guys tell me that?
Well, one of the things is that we do acknowledge that there's a large uninsured population in Los Angeles County. And so one of the things that the Board of Governors, as well as all the staff at LA Care, is that we look at ways that we can expand coverage. And so there's a bunch of different programs that LA Care is working on to be able to serve those individuals.
That's great. When you guys were, now I'm looking at the students again, when you guys were at Dana Strands, we talked about some of the barriers and stuff like that. What would you guys, how can you guys see something happening in a positive way, or what can you see that can change with those areas? Do you know? Or?
Well,
So, like we already mentioned before, there are certain things that we need to do. Like, once again, the application process has a lot to do with it. And I think also a big part of it would be education. Like, that's one of the things that our program also promoted was education to the people. A lot of it, well, since it is, you know, a large Latino population that we're dealing with, a lot of them don't know both languages and need help or assistance with certain applications. So maybe what we can do is create like advocate groups where we can go into the community, gather a group of people together and just, you know, go through the application with them step by step so that they don't feel so overwhelmed not only by the length but maybe, you know, by the words or like the language that they're using.
Right.
So we could use education.
You guys took, like I said before, you guys got a lot of data and a lot of information. What are you guys' plans with that? Are you going to share that with agencies that might be able to help, or?
Yeah, well, that data is from the beginning. When we were planning on gathering that data, the number one goal was to get that data and get that information to those people who make policy changes in terms of healthcare. We want people to know about what we found. We want them to listen to the recommendations that we have developed through our experiences with working with the community. So we plan on analyzing that data and then sending it out for publication. But in the meantime, because that could be a time-consuming process, we'd like to talk with people who are actively involved at providing health, like LA Care and like other people who are
involved or reaching out to the community, right?
Exactly. So that's our number one goal, is to get that data, get that information out.
Great. Great. Also, were you?
Well, I was also going to share about how we want to get involved in getting the information out. We have staff who speak multiple languages who can come out and give presentations. We also have set up, and we're planning on setting up more, but we have a community education center.
Great.
We've got one located, it's on 3860 West Martin Luther King Boulevard. It's in the building that THE Clinic is located in, and we're open on Wednesdays and Thursdays. We have an office there, and members of the community who might want to learn more about LA Care or might need help filling out some of those applications that you mentioned could come in. We're there from 9 to 6.
All right.
And anybody could walk in and get some help.
That's great. Well, look, we appreciate everyone that has participated in this right now. We're going to have a performance. We have Professor Mindbender and the Secret Service, and when we come back, we're going to see them. So you guys look forward to the performance. Y'all, let's go.
What if you were in trouble? Where would you turn? Volunteers of America, a nonprofit charitable organization, builds stronger communities, restoring confidence and self-reliance to help people help themselves. Abused and neglected children and families, the elderly and disabled, the homeless and people in poverty. Find out how you can help change lives in your community. Call 1-800-899-0089. Volunteers of America. There are no limits to caring.
Let's go.
Thank you. Hey everybody, welcome back. Just like I promised you, we have a great performance by Professor Mindbender and the Secret Service. You guys watch this.
We better start the evacuation.
You're now receiving a live satellite transmission from
live and direct from the facilities of Launchpad. I'm Professor Mindbender, intergalactic smuggler of different sorts. Now we must begin. Yes, for you and yours, we're now bringing you to a new age of rhythm and rhyme. So, spirit, doing my duty on tour for the hip-hop hardcore, using my wit and information stored with the aid of my vocal cords, a rattle to settle the score during the Cold War. Traveling the 134 from Pasadena with my pedal to the floor. A king going berserk, cause no one knows our folklore. Mentally creating, escaping captivity. Using the rap gift to uplift to make my tape levitate with pure energy. Endangered species for 4 centuries of being known as the public's enemy. Instantly, I'm pointing out the known beast that's been among us. Mentally controlling men. Hitler, the Pope, to Napoleon, and the mother who brung us capitalism and Columbus. 13 years of Bush and Reagan. Then a Generation X got word of Illuminati statements and how they got us practicing the holidays of European pagans. While I walk around the stages, I should cock the gauges, unload my flows, then take away your pillow. I knock down tables and bust through doors. These are the words of the secret wars. I'm going to, cause it's that I knocked out tables and bust through doors. These are the words of the secret wars. From my asylum of styling, domesticated from origin, it seems we are aliens coexisting. I'm returning the pyramids to outer space over drums and bass. I'm buzzing light years into the ears of my peers. Poetically, I'm shaking my fear. A marvel to startle the empire, conducting through speaker wire. I won't stop rocking till I reach. Now I rock any party and come correct. Why y'all civilize the savage? You give us respect. Now I knock down tables and bust through doors. These are the words of the secret wars. Yeah, going to. Now what we do is this. Now we knock down tables and bust through doors.